Okay, so treatment for sepsis. If the question indicates something about the patient being hypoxic, then you know that it's probably going to be oxygen that they need to receive. And remember that many patients with severe sepsis or septic shock are usually mechanically ventilated. And in this case, you do not elevate the head of the bed. You don't sit the patient up. Okay, they're hemodynamically unstable, so you're going to go ahead and elevate the legs and then the head of the bed no higher than 30 degrees. The patient will receive IV fluids, usually normal saline. Normal saline, lactated ringers, or albumin are all appropriate, right, because they can all expand volume, but albumin costs more. So if you were given the two options, I'm not sure which answer would be right, but normal saline is just as effective and it doesn't cost more. And if you need to infuse blood, you know that you already have normal saline running and it's compatible to infuse blood. So I think I would select normal saline. We know that the patient has an infection, so you're going to go ahead and get those blood samples, and then you're going to do you're going to send it to the lab for a culture and sensitivity. Often the doctors will not wait for that to come back, because once the diagnosis of sepsis is made, you want to go ahead and give antibiotics within the hour. And if you are going to go ahead and do that blood culture, you're going to do it from 2 different sites. It's very important to know that. And regarding the antibiotics within that hour, normally sepsis is caused by gram-negative bacteria, so doctors will often prescribe antibiotics that treat gram-negative bacteria. However, doctors can also prescribe broad-spectrum antibiotics just in case, because the longer you wait to treat the patient with antibiotics, the mortality rate goes up significantly. So the patient can get possibly vancomycin with maybe Zosyn or Cipro. So it just really depends on the doctor, but they usually give the antibiotics pretty early on. And it's very, very important to go ahead and put that central catheter in because A, you want to be able to give the patient fluids if the patient becomes unstable, because if they bottom out, you're not going to be able to get a vein. And you could draw blood from here, you can give meds from here, so definitely central catheter insertion, very, very important. And with that, you can also monitor the central venous pressure, and that's very important to understand if therapy is effective. So if IV fluid resuscitation therapy is effective, then you're going to want to see an elevation in the CVP. It may not be above 12, but you know that these patients are normally hypotensive. So if you see a central venous pressure above 8, that's where you want to be. Then you know that therapy is increasingly effective, okay? And when you draw the venous blood, you want that oxygenation in the venous blood to be 70 or above. Okay, 70 above is normal for venous blood. Lower levels than that indicate that organs are possibly hypoxic and are requiring more oxygen from the blood. So if you see a number of 70, you know that therapy is effective. The mean arterial pressure, you want that to be above 65. That's how you know that therapy is also becoming effective, because we know that we have a hypotension problem, so we do not want decreased mean arterial pressures, right? So to know that therapy is effective, you want that mean arterial pressure to be at least 65 or above. And so all the oxygen and the IV fluids and the antibiotics, these are going to be like sepsis resuscitation, okay? These are going to be what you're going to do first. And then insulin, heparin, and steroids are going to be more like management therapy. So you know that the patient's probably going to need insulin, because we talked about how the blood sugar will be elevated, right? And you want to bring that blood sugar definitely below 150. If the blood sugar can come down to baseline, that would be great, but you want to bring it below 150. Heparin is going to be given to decrease the clotting and decrease the use of clotting factors in the body. You want to monitor the lactic acid levels, keep them below 4, because we know that lactic acid is a byproduct of anaerobic metabolism. You want to keep that number above 4. You don't want that anaerobic metabolism going on in the body. Blood can be given as well, and that's another reason we definitely want that central catheter put in, because if we need to give blood, we can give it. Especially the patient, during septic shock, they're going to be bleeding out, and they're hemodynamically entirely unstable, so it just depends there. And then they'll have adrenal insufficiency, so normally it would be put on 7 days of steroids. So IV steroids would be hydrocortisone, and then if they can take oral steroids, then it would be fluorocortisone, I believe that's what it said. And then if they're spiking a high temp, you can give them an external cooling blanket, and that will bring the temperature down without risking giving them more drugs and risking any type of reaction. And external cooling blankets are actually the fastest way to bring down the temperature. So that's an option as well if you see some sort of temperature question. And additionally, I don't know how to say this one, but I know it's synthetic protein C, dotracogen alpha, can be given, and that's basically synthetic protein C, and it's given over 4 days IV, and these are patients at super high risk for death, okay, because this medication itself is very risky to give. The patients can actually bleed out, so you know that the adverse effects of this drug is probably like blood in the urine, blood in the stool, or coughing blood, or bleeding from the IV site, something like that. So you know that this drug basically prevents clots, and it increases the likelihood of the patient surviving significantly, and it decreases inflammation, the whole inflammatory process as well. So this drug is very specific to septic and sepsis and septic shock. If IV fluids aren't bringing the blood pressure up and bringing the mean arterial pressure up to at least 65, then vasopressors can be given, or norepi, which is Levophed, or dopamine. All these things are going to go ahead and vasoconstrict and help bring up that blood pressure. If the hemoglobin is greater than 10, the patient can get dobutamine. Dobutamine is basically increases the contractility of the heart. It's going to put more blood into the body. But if the hemoglobin is below 10, then anticipate that they possibly might get a blood transfusion rather than just getting dobutamine. And let's say all this works, and the patient's now going to be discharged to go home. Then you want to go ahead and teach them all those different ways to prevent infection. Wash their hands. Stay away from, crowds. Eat a healthy lifestyle. Rest, exercise, and basically all those type of things to prevent the entire situation from happening in the first place.